Hi, I'm Nancy Blotner. At Caldwell University, we believe that all citizens should be informed about the important issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Managing your health care next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by Barnabas Health. Life is better healthy. Caldwell University, New Jersey Resources, the Fidelco Group, Adler Aphasia Center, helping stroke and brain injury survivors recover their speech, the Russell Berry Foundation, and by the Mental Health Association in New Jersey. Promotional support provided by NJ Biz, all business, all New Jersey, and by Commerce Magazine.
Welcome to Caucus. I'm Steve Adubato. The Affordable Care Act has changed nearly every aspect of health care in our country. Here in the studio to discuss the best ways to navigate this new and for many challenging health care system. We have Cecilia Zalkind, who's joined us on Capitol Report many times, our sister program. She is the Executive Director of Advocates for Children of New Jersey. Dr. Vin Mitta, who is Medical Director at Oscar Health Insurance. Dr. Bruce Chung, family medicine physician and founder of City Care Family Practice. And finally, J.P. McDavid is a wellness and fitness consultant who is currently using the healthcare exchange. I want to thank all of you for joining us and trying to make sense of the current healthcare environment. Doctor, let me ask you, the healthcare exchange, is it confusing or very manageable or something in between?
Something in between, but a lot of room to improve as well.
What is it, by the way?
The healthcare exchange is an outgrowth of the Affordable Care Act, Obamacare as it's known by many, and the purpose is to offer a safe, transparent, convenient place to purchase insurance. And it's geared currently towards individuals who want to purchase insurance or small groups. And there's a variety of choices on the exchange. Different health plans that choose to offer a plan on the exchange can post details about their plan, their rates, the benefits that they offer. And the goal is to offer a arena where members can make an informed choice about which plan is the right fit for them.
So right now, someone watching, they've obviously heard about the Affordable Care Act, Obamacare, however someone chooses to describe it. They do what? They go on healthcare.gov. Is that what you did?
My financial advisor suggested something. I got kicked out of my insurance company with Obamacare when it came in, and I went a couple of months with no insurance. I've been self-employed for about 40 years and have been searching through all the different ways of getting insurance, and Oscar popped up and I looked at it and it fit the criteria, but it was an online experience for me.
But you, okay, to be clear, you you got ill.
I got ill after, about 2 years after. Yeah.
After.
Yeah.
But you go on the exchange. Talk about navigating it, because for many, you're smiling as I say.
Well, it's the search. I mean, we all want the best quality for the lowest price, especially self-employed. I mean, every dollar counts. So you're looking for the best plan, the best company for the best price. So
best deductibles you're looking for.
Deductibles, premiums.
So and you felt confident that you had enough information to do that.
Yeah, well, you didn't have a choice. You had to have insurance. You have to have it because something bad happens.
But you felt confident that you were making the best choice.
Yeah.
Okay. So here's the thing, Cecilia, as people watching right now, is it a fact? Someone can say, well, it's overwhelming to me. Okay, fine. But is it not a fact, Cecilia, that more and more Americans are going to have to get enough information to go on that exchange and make the best choice they can make?
Yes. I think having that outreach and ease of information and enrollment is critical to making this work. You know, we see this from the perspective of children.
Describe your organization. I don't want to assume just because you've been on our other programs that people know what ACNJ is. So go ahead.
Well, we're a child advocacy organization in Newark. We do not provide direct services, but work on policy issues. And ensuring that children have access to health insurance has been a big goal of ours. And we've been involved in many iterations of that, from 15 years ago when Family Care, our state child health insurance program, was first initiated. So our goal is looking at those low-income families with children who need to ensure not only that their children are insured, but they are too.
So how does the exchange come into this?
Well, I think the exchange has been helpful in the sense of providing information, but more importantly, enrolling parents. We have a child health insurance program that covers children, low income through Medicaid, a higher pay for others. But over the years, it has covered parents and then dropped parents. So before the Affordable Care Act, parents were not covered. And we've seen over the years that if parents do not have health care coverage, they are less likely to insure their children. So one thing immediately that the Affordable Care Act did was it provided an entree for families where the parent could not only get insurance for themselves, but learn about the options for their children. And we've seen a substantial drop in the number of uninsured children.
You have seen that?
Yes.
And doctor, let me ask you this. Your area is family medicine.
Family practice, yes.
So when patients come in with coverage through the insurance, how informed are they, and do they have a realistic expectation as to what they're covered for and not?
Well,
By and large.
By and large, they do not. So JP is a perfect example of someone who is a independent contractor, they're a self-employed person, and for many years, those patients could not afford insurance. You go to a larger...
Because they're not with a group. They're not with an employer.
Well, they don't work with an employer,
Right.
and if you go to them as an individual, it's way too expensive. So those people would pay cash at my practice.
Right.
So now, all of a sudden, the exchange opens up. They can pay a lesser amount
Sure.
of premiums and get the care that they need. However, there can be different deductibles depending on how much you pay. And that's the part that most patients don't understand, is that initially, many of their services that they're trying to obtain won't be covered by their insurance, but will have to be out of their pocket through their deductible. So there needs to be some education about that, so they don't blame their doctor for having, paying
Because that's
charging
beyond
too
your
much.
control?
Right, it's beyond my control. They signed up for the program, the deductible, and when they come in with their first visit, maybe you haven't seen a doctor 15 years. You come in, they've been saving their problems for many years, come in for their physical, I have 20 problems. So you try to do them, but many of those problems won't be covered by their deductible. And they say, well, now I've got insurance, didn't cover anything. So they're very angry at me, they may be angry at Oscar, they're angry
or whomever,
at Obamacare.
and it could be any insurance company. Because, by the way, let's make it clear. There are, I believe, 4 or 5, if I'm wrong on this, you'll help me, Doctor, I believe 4 or 5 companies that are on the exchange right now in New Jersey that are eligible to sell insurance. Is that a fair assessment?
That's a fair assessment, and to Dr. Chung's point, there is a lot of confusion around the deductibles, the cost shares, what's paid for and what's not. And so,
why?
Well, a couple of reasons. One is this is a new population that hasn't had insurance in the past, and so it's a new product. The second reason is that insurance is complicated. And
by the nature of it?
Well, at Oscar, we would argue that it's unnecessarily complicated and that there's a lot of things that we could do to maybe simplify the entire process.
Okay, take a step back.
Yeah.
Sorry for interrupting. Deductible, premium. Help me, help all of us who just struggle with those terms themselves. What are they?
Sure, it's a great question. The premium is the amount that you pay on a monthly basis to get coverage from a health insurer.
So, for example?
You may pay $350 a month. Maybe it's $200. It depends.
Whatever the number is.
Whatever that number is. That you
every
pay
month.
Every month, regardless of whether you see a doctor or not.
Doesn't matter. That's my premium.
And that's your premium.
Got it.
Exactly. Your deductible is the number that is a part of your plan, and it determines how much you have to pay before the insurance plan comes in and starts covering services for you. And so if a patient with a $1,000 deductible sees Dr. Chung, the first $1,000 of service would be covered by the member before the health plan would kick in and start covering services. There are variations to that, unfortunately, which lends to the complexity of certain services that are covered.
And why are there
before
variations?
So in some cases, like Oscar, for example, we cover a number of services without applying it to the deductible. So generic drugs, office visits, telemedicine services are all covered without applying to the deductible.
They don't go against the deductible.
Correct. They don't go against the deductible. And so it's our belief, and with a number of other health insurers, that core primary care services, things that aren't associated with a catastrophic illness that you couldn't predict, should be covered before your deductible, because the purpose is to ensure a holistic, thoughtful, accessible primary care experience.
But everyone has their own approach to this. And to what degree do you feel that you understand the deal?
You got a general understanding, but it doesn't become real until it slaps you in the face. You know, you go see the
You
doctors
mean you get the
and
bill?
you get the bill, and they go, "What do you mean you didn't cover that? You're supposed to cover that." Or in my case, I've ran into this.
Tell everybody, if you don't mind, what you don't want to talk about, don't.
That's okay. I just picked up this strange TB infection in my hand, which is rare, and you know, the deductible was covered.
It was a skin disease?
It's a skin, yeah, instantly, because I went to the emergency room, and I mean, next thing I know, my deductibles have been covered. But when I was getting the plan, I would look at what's a deductible that I can manage with how much money I make, how much is the premium, and it all gets to, you know, dollars and cents to what's the best deal.
So interesting, Celia. We've been we've been doing these programs, and I've been hosting these programs, the more it's becoming clear to me that insurance, and I'll put myself in this category, I've not wanted to think about it. I wanted to say, that's a part of my life, our family's life, that I know is a reality, a necessity. I can't avoid it. It's irresponsible, right? You can't, you shouldn't. But I don't want to know that much. It's a terrible, terrible approach. But we can no longer, those of us who fall into that category, we don't have that option anymore. We have to learn. We have to understand. We'll never be experts per se, but we have to be very informed consumers.
Well, I think that's right. I think the benefit of the Affordable Care Act is it offers insurance to people who have never been able to access it before. The challenge is then you are the consumer of your own insurance, right? So I'm an employer as well. I have an agency of 17 people. We provide health insurance to our employees.
So what did you have to do? So we run a small not-for-profit. We have to make decisions about our employees. What did you have to do?
Well, I'd say the last 5 or 6 years have been a huge challenge, right? We, as a small nonprofit, we made a commitment years ago, our board made the commitment that we were going to pay full health benefits without an employee contribution because we could not offer competitive salaries with corporate America.
Got it.
And that we have tried to maintain that commitment. But we
It becomes
faced
more challenging.
Yeah, we faced 3 years in a row where our health premium went up 25%. That's huge. You know, we're dependent on foundation grants. We don't accept any
I'm sorry, you're
state
talking about
funding.
public television, or you're talking about your organization?
I guess both of us. So you know the challenges. That's a challenge. So a couple of years ago, we went through a process and decided to not offer the premium plan. So our employees have the basic.
Sure.
But it does not allow them, for example, to go out of state.
But here's the point, though. Each person has to know the situation.
Yes.
They have to be more informed. And by the way, has the exchange come into play yet?
Not for us yet.
But it may.
It may.
It may come
we've
into-
had 3 years where our insurers come back and said, we'll maintain you with a slight increase.
But
And
here's the thing. Is it fair to say, doctor, that the exchange is likely to come into play more and more with more Americans?
I think so.
Because?
Well, because many people lose their jobs as the economy goes down, so they need another way to get their insurance. And then
How about competitive pricing?
competitive pricing between...
Is the exchange a place where competitive pricing is likely to come more into play?
I don't think so, because I think the government does a lot of subsidy.
I would disagree.
Okay, keep talking about this. Go ahead.
I think it's interesting that when someone signs up on the exchange, the main items that they see are the price and the network and the benefits that are associated with it. And so a lot of our members that do sign up, of course, many of them come to us because of the benefits that we offer and the telemedicine services and all those things. But price is a big driver, especially for a product that you don't plan to use. And if it's something that you don't
I didn't plan to get sick, doctor. Right?
It's true. Exactly. You don't plan to. And so if you're not planning to, then price is important.
And by the way, let's talk about the technology part. How much is technology driving the costs associated with healthcare? and overall quality of healthcare that's delivered. You keep mentioning the telemedicine piece of this. What does that mean?
Well, at Oscar, what it means is any member of ours can speak to a doctor within 15 minutes on the phone by requesting it via our mobile app or via our website. And we view that as a win-win for both us and for the member. It saves the member from unnecessarily having to go to the emergency room or an urgent care center for a quick conversation, something that can be taken care of over the phone. And for us, we view it as an opportunity to prevent unnecessary visits.
Dr. Chung, you believe that face-to-face communication between the doctor and patient is critical. Talk about it, and talk to your colleague.
Right. Well, I think as far as a patient like this that comes into a family doctor's office, the most important thing they can do is make a relationship with their doctor. So the first thing is someone gets into the plan, they go through all the administrative part of joining affordable health care plan. They should find a doctor that they like, a doctor that has an office that has availability for them to be seen, a doctor that will sit down with them on their first visit, get to know them, build the trust between the doctor and the patient, so that as your problems move on, whether it's a skin rash, whether it's your high blood pressure, not that you have high blood pressure, whatever you have, you can build up a relationship.
Why can't technology establish that?
Well, technology is okay, but Oscar is only one aspect of it. You have a small problem like a rash, and you call the doctor at Oscar, he can't see the rash.
Or any other, just to be clear, or any other place that provides that service. Go ahead.
Well, I think nothing can replace a human interaction with a doctor.
Yeah, you need both.
Are you saying that?
No, absolutely not. I think the human interaction is crucial, and I firmly believe with your point that all of these different technologies need to be woven together so that it ensures a continuous connected experience for the member. And for us, when a member does have a telemedicine call, we put that information both on the website for the member as well as send it to their primary care doctor so that they have the information, so that if they do call about a rash, the next time they go to see you, you can pull that up and see
There's
that
history.
they
And
have
I've used both.
I've done the phone, and I've also done.
I said this in a previous program, and I'll say it again. I happened right now, literally as we're doing this program, I had something, and I promise we're going to do a program on this. What did I say? I'm actually drawing a blank on what it's called. Vertigo, that's right. I intentionally tried to forget it. I experienced vertigo. My mother had for years, and she goes, and I said, oh, Ma, how bad could it be? And then I got it. I go, oh, that's what you're talking about. And it's a dizzy, you know what it is, right? I'm not telling doctors, right, how serious it is. And so I said, you know what? And I went to see an ENT specialist whom I knew, who's been texting me during the day today, because vertigo does make you very dizzy, and there's a certain medication. And he texted, in between shows, he said to me, tell me what you're feeling. Do we need to talk? Pick up the phone. And I thought to myself, he's not saying come into the office. I would love to see him, but I can't because I'm here. He's where he is. There was a lot of value in that. Cecilia, am I making too much of that?
No, I think that's really important. I do. I think that's all part. I think that's part of the relationship.
But I have a relationship with him.
Well, it's great the doctor called you back. That's the other.
But I also have a relationship with him. I want to make that clear. There's history there. And it does matter. Is telemedicine changing the doctor-patient communication and relationship?
I would argue that it's leveraging it. Technology makes those interactions more timely. You have those interactions when you need to, like in the case of vertigo, and it links them all together so that you have a continuous understanding of a patient's healthcare history. And so telemedicine is just the first step in that, but we view all of the technology innovations that we have, such as getting notifications from the ER when a member hits the emergency room, as an opportunity to put the right information in front of the doctor at the right moment, because you're right, that final interaction is a human-to-human one, and that's the crucial part. And for Oscar, it's about making that human-to-human interaction as powerful as possible.
Let's talk about children.
I definitely agree that Oscar has done that. When you look at their website, it's very friendly, and the patients that we see that have Oscar, they kind of know us already because they've seen our profiles on the internet, they've seen our face, they know our offices. Other insurance companies say, big Aetna, you get a book, here's a book, go see your doctor.
Well, listen, everyone has their own strengths, and people can decide for themselves in terms of the 4 or 5, if you will, insurance companies that are on the exchange in New Jersey. But Celia, let me ask you this. There are children that you are particularly concerned about. Talk about what we have found in terms of chronic conditions that show, like, let's talk about asthma.
Right.
How does that even enter into this discussion vis-a-vis post ACA, and the exchange?
Well, you know, I have two answers to that. One, because we've done some intense work on absenteeism in Newark. We're just finishing a report on that. And asthma is a huge issue.
Absenteeism in school.
In school. In
very
Newark.
high
Very
percentage
high
in urban
percentage.
areas.
So part of our advocacy for the child health insurance program is to move away from health care that's provided at the emergency room when there's a crisis to more preventive care that a family gets earlier on for their child. And I think that's happening. But what we've seen and what we've heard in our look at absenteeism in school is that we may have moved away from the emergency room, but we're not quite at the preventive care yet. So using asthma as an example, what we heard from parents is a parent has a healthcare provider, their child is diagnosed with asthma, they have the acute response. So they go to school with the inhaler.
Right.
So if a child has an attack in school, they have the inhaler to use. They may have a nebulizer at home that they can use. But in terms of that preventive care that child should be on so that those attacks don't take place, when parents we talked to, not many knew about that and either didn't understand or that had not been explained to them fully by their healthcare provider. So I think we've made a lot of progress in moving away from emergency room care. I think that's very positive. But in terms of children and preventive care, I think we still have a ways to go.
So let's talk about this. Cecilia raises a great point. To what degree does the new healthcare environment, the landscape that we're talking about today, and the exchange, provide information about prevention and wellness? I mean, do you see it there?
Yeah, drastically in the last 10, 12 years. I mean,
you see it.
Oh, yeah.
You see it there.
Yeah, I mean, that's what I teach, preventive health. I mean,
there's sections right there where you find it there. And that's something that you see as well across the board?
I do agree, because what will happen is someone will join an insurance plan, and then they'll say the first thing is go to your doctor for your physical. And then they come in. Otherwise, they would never come in because it costs too much. There's some problem about coming in. But as soon as they get their plan, go see your doctor for a physical.
They pay for gym memberships. They pay for, I mean, they sent out a fit bracelet recently. I mean, they really do try to help start the preventative.
Legislation has helped that too.
What do you mean?
The Affordable Care Act has mandated that preventive care is covered by the insurance plan. And
yeah,
so,
but isn't it, Doctor, respectfully, is it defined specifically in the legislation as to what preventive care really means?
It is. They define a method by which a service is defined is
so for example,
designated as preventive care. And so all of prenatal care, well visits for a woman during her pregnancy are considered preventive care. Annual cholesterol and diabetes screening is considered preventive care. Certain studies based on your age and other risk factors
got to be covered.
Have to be covered.
So
and have to be free.
Hold on. So you're saying that on the exchange, those services, some of those tests, have to be provided, have to be covered, and have to be free?
That's exactly correct. And it can be complicated.
That's the other area that's the most complicated for patients, is they'll come in for their physical or their first initial visit, and they may have other problems. And deciding which one's going to be covered, which part is part of their deductible, is very confusing for them.
Well, how would they know, doctor?
They don't know. Even doctors don't know. Sometimes
wait.
Well, we know what their problems are, but we may not know which is covered and which may be part of their deductible.
So let me ask you something. In your office, I'm always fascinated by physicians' offices and how you're set up. Do you have someone dedicated to do nothing but navigate this landscape?
Yes. So in our office, we have 3 doctors and then 8 other staff. The other 8 other staff, the majority of their work is allowing us to survive by interacting with the insurance companies. You know, collecting the demographic information from the patients, making sure we document everything, make sure the bill goes to the insurance company, and then the back and forth argument about what's going to be part of their deductible, what's going to be paid, which code is correct.
But respectfully, if it's so clear cut, then why is there such a spirited debate?
Which part is clear cut? Deductible, and it's confusing. Which area?
Got a minute left.
Yeah.
Is this just the way it is and the way it's going to be?
This is the way it is, but this is not the way it should be or the way it has to be.
Where are we going then? Minute left. Go ahead. Where are we going?
There's a huge opportunity to simplify this interaction both with members and with doctors. And with members, we and a lot of other health insurers have done a ton of work to simplify what is covered, what is not, what a deductible is on our website, on our mobile app, and have the ability to ask smart questions to your insurer and get those answers in a timely fashion. Very responsive customer service, very thoughtful design, and a layout of what exactly is our health insurance product. On the physician side, 20 to 30% of physician time is spent recovering revenue from insurers that should be paid in the first place. For us, we view it as a huge opportunity for cost savings. Simplify their lives, we save money, they save money as well. And so it's not the way it needs to be. I think technology is a huge way to fix it.
Put it this way, and we will continue to do our part to help inform the public, all of you who are trying to navigate the healthcare landscape. Thank you all very much.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Barnabas Health, Caldwell University, New Jersey Resources, the Fidelco Group, Adler Aphasia Center, the Russell Berry Foundation, and by the Mental Health Association in New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Think of 5 people in your life, including yourself. At least one is struggling with a mental health condition. And heroin and prescription drug overdoses are among the leading causes of accidental death in the United States. The Mental Health Association in New Jersey is a leader in advocacy, training, and services for behavioral health, including mental health and substance use disorders. The challenges are real, but recovery is possible.